Hello and welcome to the fourth visit to the CommonWell pilot sites. We are today in MiltonKeynes in the UK, some 60 kilometers northwest of London. The CommonWell service here in MiltonKeynes is addressed to people with chronic obstructive pulmonary disease, or COPD. To see how the pilot has been running, we are first of all going to talk to some people from the MiltonKeynes Council and the NHS of MiltonKeynes.
The CommonWell service in MiltonKeynes aims at supporting people with COPD with an ICT-enabled integrated social and healthcare service. The MiltonKeynes Council recognized that there is a need to move away from a one-size-fits-all approach of reactive care, which is often delivered in a hospital setup, to a patient-centered, responsive and flexible service. MiltonKeynes Council and MiltonKeynes Community Health Services are working together to develop effective ways of helping people with COPD. The aim is to reduce unnecessary admissions to hospital and to facilitate early supported discharge from hospital following an exacerbation of COPD. A telehealth monitoring system and a community alarm are installed at the patient's home. Each day, the patients measure their vital signs including heart rate, weight, blood pressure, oxygen saturation levels and temperature. Alert limits of the vital signs are set by their lead clinician. The monitor also asks a series of clinical questions to further determine the current health condition of the patient. The readings are transmitted via a web application to the community matrons or district nurses for clinical triage and to the alarm center for technical triage. The reading takes the patient approximately 5 to 6 minutes. Telehealth readings are monitored on a daily basis and critical information is passed to a named clinician who is able to facilitate early intervention and prevent a rapid deterioration which could lead to an unnecessary admission to hospital. CommonWell will enable health and social care data to be integrated to provide more comprehensive and complete patient information which is used to deliver a more joined-up and responsive service.
So, Eileen, Gillian, thanks a lot for welcoming us to MiltonKeynes and to the CommonWell site here. Eileen, maybe you can say a few words about yourself and particularly, of course, also how the service has been running up to now. I mean, you're now, how many months into your trial? You're 10 months into your trial by now.
Yeah, 11 almost, yeah.
11.
Yes, we started the installations of our CommonWell patients in the middle of August. And we actually started to look at the data at the beginning of October. So the patients were going onto the monitors from the middle of August and we were looking then overall at the data presented on the system from the beginning of October, where what we started with was 108 patients and we're currently reducing that number week on week as patients have their final interviews. So we're currently down to 44 patients still part of the project. The majority of the patients have now come off.
And Gillian, you're working for the NHS here in MiltonKeynes?
Yes, that's right. I'm integrated telehealth clinical lead, working with health and with the council. The job came about as a drop back really from CommonWell, because the project has been taken so well with people with telehealth and COPD that the potential to take this forward in MiltonKeynes with other long-term conditions is really an opportunity that we cannot afford to miss. It's helping people to manage their conditions much better and keeping them out of hospital.
Mm-hmm. And can you say a bit about, from the experience of a healthcare professional, what experience have you made so far with CommonWell? How is it going?
As a healthcare professional, it enables us to look after a lot more patients with fewer resources than what we've got, because that's always an issue. And particularly when the weather was really bad, we were able to look after nearly 100 patients with telehealth monitoring, whereas we probably wouldn't have been able to access them because of the weather. And it helped them to understand that there's somebody there no matter what. There's nothing that's going to stop that contact. And it's also helped reduces them going into hospital. The patients feel that there's somebody interested in their condition, whether they're poorly or whether they're in a stable condition every day. And the reassurance and stress relief that gives them is unsurmountable.
Mm. And I know you've been also seeing patients in their home. Can you summarize a bit what their impression is? Are they happy with the service? Are they feeling effects from it, or is it more of a burden?
They may have found doing their readings daily initially a bit of a bind, but a lot of them now say it's part and parcel of their routine. It's at a time to suit them. Sometimes the time was a little bit early and it has been changed. But no, they don't find it a burden at all. They find it very easy to do. They've always done their readings in about 5 minutes and they haven't experienced any problem. They like the way they're asked to take part of the project. They like the way the installation took place, and also they're very impressed with the support that they've received both from ourselves and from the council while the project has been running. And not many of them want to come off it. They want to keep the monitors. It's very difficult to take the monitors away.
Mm. Yeah, that's always a difficult situation. Yeah.
Mm.
If we're looking into the medium-term future, what do you think is the perspective of what you're trialing here now? What's going to come out of it?
I think what the project has allowed us to do is actually develop the relationship that we have with health, and it's shown very definitely now that with the bonuses that we've given to the health service in relation to where we support them with the installation of the equipment and the management of the equipment side of it, where the clinicians really don't have time to do that type of work. But what they need to concentrate on and can do is actually looking after their patients. But being able to do that on a much more regular basis, because the patient data that they now receive is so complete about their patients. They know which ones who need to see them at a particular time. So where you have patients who are particularly poorly and need support, those patients will identify on the system, and the nurses and the matrons are able to prioritise their visits based on that. So I think overall what the project has allowed us to do is actually show that real benefit from the clinical side and from the alarm side as well, where we support each other, but actually neither of us could do the job alone.
So Eileen and Gillian, thanks a lot. Earlier today we had a chance to visit one of the participants in the CommonWell service who has been on telemonitoring since October last year, and that gave us some interesting insights into what CommonWell actually means for people in their day-to-day life.
John Smith has been admitted to hospital following an exacerbation of his COPD a few months ago. After discharge from hospital, he is now one of the CommonWell patients and receives an integrated service from the MiltonKeynes Council and the NHS.
It's still very bad since I had the operation last June. It's where all the damage was done to me.
Okay.
But that's just bad luck. It happens. It's nice to know that when I get a phone call some days, are you all right? Because this is so good that this is monitored daily at the other end of the telephone, because it sends out the measurements as I take them. That if they're looking down it and they see that my blood pressure's jumped up 15 from the day before, that phone rings. Well, the phone rings, and you know, would you mind doing it again now? Were you worked up or anything, or stressed in any way this morning? But
Yeah, sure.
what I'm trying to say is how good this thing is, because within the hour I had a phone call asking, are you well? When all this equipment was first set up here, how long have we got to put up with that? That was the response. But now, because of the good that has come from it, nothing's ever said. No, nothing's ever said. Because some people, even when you give them a push and the chance to help themselves, they don't. They're so silly. They're short-sighted, you know. They've got so used to just, I've got an incurable disease, it's going to kill me eventually. And they sit and vegetate on that. Well, I'm afraid I was guilty of that up until January the 7th I started. And since then I've never looked back there. With my age group, once you've had those 70 years and 10, you're no longer putting anything in towards the economy. So I think you drop down on the priority list a bit. That's how I felt. Mm-hmm. But this, that takes back my words, because this is wonderful. And because that's there, it makes me feel better in myself. I don't worry anymore. Mm. Because if something is wrong, I know this from day to day, and all I've got to do is press that button and they'll have an ambulance here. Or somebody else first to check me over. And it's a wonderful feeling when you've got these problems. Right. So I'm hoping that the politicians find the money and use it correctly.
So, Sandra, you've been the project lead for CommonWell here at the MiltonKeynes Council. Now that the project is somehow coming to a close, could you tell us a bit more about how it's going to go on, what your plans are for the future?
Yes, CommonWell's been a really good opportunity for us to use telehealth monitoring equipment for patients with COPD. And now what we want to do is have a look at how telehealth can help people with other long-term conditions, specifically chronic heart disease. So we have been working really closely with our community nursing service and with the hospital to see how else this equipment can benefit patients across Milton-Keynes.
Okay, so thank you very much, and thanks to your staff for all the work you've done so far. And this was the last visit to the CommonWell pilot sites. We hope you enjoyed it, and see you soon with another update on our project. Bye bye.